Age-related hearing loss is generally perceived to be a normal part of the aging process, yet remains an undertreated condition among our aging population. In fact, 1 out of 3 people over age 65 have some degree of hearing loss. What's even more concerning is that hearing loss has been linked to cognitive decline. According to a study published in JAMA, seniors with hearing impairment were 24% more likely to have memory and thinking deficits when compared to seniors with normal hearing. The more severe the hearing loss, the more likely they were to have cognitive problems. But even those with mild hearing loss had a greater rate of cognitive decline. The reason? Scientists speculate that poor hearing increases the cognitive load on the brain. When the cells in the inner ear are damaged and can't regenerate, as with age-related hearing loss, the cells send a garbled signal to the brain instead of a crystal clear one. Decoding the garbled message takes more effort for the brain to decipher and can eventually lead to brain atrophy. The upside? Scientists believe that people who treat hearing loss early and more aggressively may stave off cognitive decline. The audiology specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery explain that if you or someone you know has difficulty hearing, the sooner you get tested, the better your quality of life.
There are many different things that can cause hearing loss. The most common would be aging and just degeneration of the hearing nerve. Noise exposure, men who work in a factory around loud equipment. Family history can play a part, genetics, but we also can see some ototoxicity with certain medications that you take, and in those cases the physician who is administering that medication will refer the patient for monitoring to monitor the hearing over time as they take that medication to make sure that they're not losing a lot of the hearing. Hearing loss can be genetically related, and so we always would recommend that if you do have a strong history of hearing loss in your family members, then we can have a hearing test performed and we will have a baseline to compare it to so that we can determine, is your hearing starting to progress? Is this just an episode that we can treat medically and have it recover? Or are we starting to see some aging? Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. Symptoms of damage to the hearing nerve are tinnitus and hearing loss, and the two of them usually go together. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing. Occasionally we will see someone who has a sudden hearing loss, and there are some ways of treating sudden hearing losses that we might see some recovery. But in general, when you start to see the gradual progression from the aging process, it's not something that we can recover. As aging occurs, there's damage to the hearing nerve. There's no way to stop it from happening. You'll just continue to have a progressive hearing loss over time. The sooner you move into a hearing aid early on in your hearing loss, the easier it is going to be for you to adjust. The people who wait and wait and wait and put it off and slowly over time forget all of the sounds in the environment that they hear have much more difficult time adjusting to hearing aids. And a hearing aid does you no good if it's sitting in a drawer. It's something that you need to communicate with your provider, you need to come back in, have some adjustments made. There are things that can be done to make it easier to get adjusted to.
For appointments and more information on hearing aids and the audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click the Hearing Loss and Dementia story link on our homepage at yourhometownhealth.com.